so that you are able to make sure that you can see him. We do have closed captioning that will be dropped in the chat, so definitely click that link if that is what you need right now. And if during the question and answer session, we will be employing progressive stacking still. So by this time, you should all know hopefully what that is, which is if you choose to self-identify as a BIPOC member, you can go ahead and use an asterisk before your question or comment, and our chat moderators will definitely make sure to prioritize your question or comment. We do have chat moderators during the question and answer session that'll be probably the last 10 or 15 minutes of this conversation, and they'll be tracking those questions. So if there are questions that are coming in and we don't get to them and we're not responding to them, that's because we've set aside time at the end to get to those questions. Let's see. As always, we are recording this session. It should be live immediately on our YouTube at the end of this. We are also live streaming on YouTube, so folks can access that there if they have better sound with the YouTube versus this one. As always, I am Ozzy Alosium. My pronouns are she, her, and hers, and I will let my fellow co-presenters introduce themselves, starting with Christina to my over here.
Hi, good morning. I'm Christina McClellan, she, her, and I'm the project director for the IMLS grant that is funding the project we're going to talk about today, which also includes the symposium you're all taking part in.
Hi, my name is Laura Tadena. I am an Inclusive Services Consultant with the Texas State Library and Archives Commission.
Hi, everyone. I'm Namrita Singh. I am the Principal Advisor of Health Research Toolbox, which is a health equity consulting firm here in Denver. And I will be speaking about our qualitative findings.
So thank you all for that. Our virtual producer, Zakia, will go ahead and queue up our slides. Again, I'm so sorry for starting late, which means we'll probably run a little late. So for those of you who can stay, definitely please stay to the end of it. If not, it will be recorded so you can catch there if you have to hop out at the end of the hour.
Ozzy, can you make me co-host again?
There you go.
All right, do we have the slides live? Oh, there we go. Oh, I think we need to start with the other slide deck, actually, Zakia.
One moment.
Thank you.
Thank you all for your patience as we navigate this. Thank you for that comment. I appreciate that.
And I think big props to Zakia, as always, for being our amazing technical lead on all of this stuff.
Mm-hmm. We found Zakia like a week and a half before registration opened and proposed the idea, and she's like, yeah, I'll do it. Even though it was super short notice, and she has been able to turn around an amazing product. So I am deeply forever grateful for her.
Ozzy, can you give me the name of that one? That's the only presentation I'm finding.
It's what the data reveals. I can just pull it up on my end for now. Okay, so it's up on, and then Christina, you can just tell me when to advance.
All right, thanks very much. So if you want to advance to the next slide, Ozzy, that's great. So we did go ahead and introduce ourselves, but again, we have folks here from Denver Public Library, Health Research Toolbox, and of course, from the Texas State Library. So glad to have this team working on this together. And you'll see me switching back and forth. I have another monitor here. So thanks again for advancing, Ozzy. So today we will kind of provide some context on DPL's grant-funded project, also present some information about our national environmental scan, and Ozzy and Laura will take the lead on that. Namrita will provide initial themes from interviews with current and former DPL staff, and then we'll have time for questions. So as Ozzy said, this format is a little bit different than what we have done for some of our other sessions, which have been more of a panel discussion, but we will have some time for questions at the end. Next slide. Thanks. So the grant that we received is called Building a Pipeline of Community Connections. So that's a planning grant funded by IMLS, or the Institute for Museum and Library Services, through their Laura Bush 21st Century Librarian Program. And this grant is really to explore how libraries can build and support internal cultures representative of the communities they serve, creating replicable staffing models that model diversity, equity, and inclusion, value lived experience, and really value community relationships as qualifications. And our aim with this project is to develop recommendations to share nationally, and also to create a plan for implementation at Denver Public Library, and ultimately to implement some of these recommendations here. And so we received this grant right about this time last year. Next slide, please. So again, the major project activities of this grant are to conduct an environmental scan, interview current and former staff with identities underrepresented in the library field, convene a national symposium to create a learning community, which you are all attending right now, and we're so grateful for you to be here, create a report establishing recommendations for this work in the community, and then also to create a culturally responsive wellness model and pilot implementation to work with some culturally responsive wellness consultants. And major props to Ozzy on that. When this program was first developed, when we wrote the grant, Ozzy was not yet a part of our team, and Ozzy was able to be brought on because of this grant, and this was something that she really spearheaded. So I'm so glad we've been able to add this to our work, and it's so important. So next slide, please. So I did want to just kind of give a little background about Denver Public Library and kind of some pieces of what led us to seek this grant. You can see on your screen just some data around demographics of staff at our institution. And so you will see with positions as of 2019 that required a master's degree in library and information studies, our staff was 78% white. However, positions not requiring that master's degree, our staff was 52% white. So there's a big difference there, and I'll show some data in the next slide on our community as a whole. But we do have a program called Plazas, which are run by our incredible Department of Cultural Inclusivity. And these programs support our immigrant and refugee and asylee community members through a variety of services. Before COVID times, this included live programs at 10 of our library branches where we presented programs on English language conversation, on taking the citizenship exam. And I see Virginia has just popped into the chat with a link to that, which is awesome, as well as arts activities, homework help, et cetera, for families. And we found that our staff in those roles was very diverse and very connected to our community. However, because these positions were very part-time, we had huge turnover in them. So in 2018, 27% of those staff positions left for another position at DPL, and often they were positions that were quite different than what they were doing at Plazas. So not as community focused, not working with these communities, and 32% left for full-time jobs elsewhere. You can go to the next slide. So you'll see here Denver County population data as of American Community Survey 2019 data. And again, these titles are again based on what is on that site. But you'll see that in Denver that the white alone population is about 53%, Latinx is about 28%. And I will preface that and add the caveat that of course we know that census data does not tell the whole story. And of course we also know that we shouldn't only use demographic information to let us know where we need to be with our staff. So we know that it's important that our staff reflect the communities that we serve and that they have those connections to those communities to be effective. But at the same time, Denver has experienced a huge amount of gentrification that has really changed our community in the last 10 years. There was recently a study that came out that we can send out that showed that Denver was the #2 most gentrified community in the US after San Francisco between 2013 and 2017. And we've seen a huge number of our community members move out of Denver County, although many are in surrounding counties and are still using our services. So just wanted to mention that, especially because we have so many folks here who are not in Denver. And you know, this also kind of leads to why we really wanted to prioritize the qualitative interviews with current and former staff and really get that qualitative story as well. Next slide. So a little bit about some of the things that we have been doing prior to this grant and are continue to be doing. So we do have an Equity, Diversity, and Inclusion Committee that formed in 2018, building off of a staff project in 2017. We were able to add lived experience as a qualification in some of our hiring. This really came out of our social work team that had peer navigator positions and still has these positions, which are folks who have lived experience of homelessness and or substance use. So it was a big process to get that to be a qualification we could use in hiring, and we were able to do that. We were also able to remove bachelor's degree requirements from some positions. And we also did create a new strategic plan last year with 5 new organizational values, including equity, and we are now hiring a full-time EDI manager. So of course we have a long way to go, but just to speak to kind of some of the things that we have been doing as an organization. Next slide. And then just kind of to add some context to the national need, of course, you know, I think all of you who are here are aware of that, but just some, you know, some data that I thought I would just touch on. 2010 paper by Gulati showed that there was 1 white librarian for every 1,830 white people, but 1 Latinx librarian for every over 9,000 Latinx community members. So, you know, just a huge disparity there. And also in the 2017 ALA demographics study, 87% of library staff identified as white, and that was only a 4% decrease from 2014. And then of course we have to confront the library legacy of institutional racism. Next slide. I don't know how many of you have seen this website, but it's one that I always like to share. Ariel Aberg-Reiger's illustrated history of the American Public Library that really goes into some of that institutional racism. You know, we have to be able to confront the fact that libraries, you know, are part of this governmental history of systemic and structural racism. I think sometimes you know, particularly white staff don't know about that history. And I think this website really goes through that. And because it's illustrated, I think it's a good way to kind of bring people in. People kind of take in that information, I think, in a way that maybe they wouldn't always. I think of it a little bit of as a Trojan horse that I send people because they like to see the picture. So we'll send out that link as well for those who are not familiar with that. So go ahead to the next slide. And we'll now kick things over to Laura and to Ozzy.
Okay. Am I back on screen? Okay, awesome. So thank you, Christina, for that awesome introduction to this piece. So part of my job, right, was to convene the symposium. The other part was to help spearhead this environmental scan. And what that meant was that we are trying to the goal of the scan was to look at different library systems to determine how they're applying an EDI framework, a racial equity framework, to staffing and workforce development. And so it was mixed methodology, meaning we used both quantitative metrics, we used a survey, and we used interviews. And so like I said in the last section, or last session, I'm really passionate about research in general, but I was really interested in what organizational assessments existed around how EDI is embedded throughout the entire organization. And so what that meant is, prior to starting at DPL in December, I was doing some consulting and some other work in other areas and had compiled a list of different assessments that I thought were promising, but didn't completely capture it, and use that to create a really robust, it's a very long survey that we used then to assess different library systems. And so it was in 156 item rubric that looked at EDI and its embedment in organizations, from strategy, from policies, to organizational diversity, to training, to performance evaluation, and a whole host of other things. I believe that is available and was available on the homepage of the Hay Summit site, where it has all of the pre-work. We included the survey there, and we included the interview questions that we created. And so after we sent out the survey to different public library institutions, I believe every public library director received that. We used the PLA EDISJ channel. We used our steering committee and their channels. We emailed all 50 state library associations, et cetera. And we got back a total of 90 completed surveys that we're still in the process of analyzing and all of those things. But one of the things that we allowed participants to select on the survey was whether or not they were interested in doing a follow-up interview. And so a handful of folks agreed to do the interview, and we're still in the process of conducting continued interviews. I have been leading those. And so right now we have done, I want to say we've done 12 interviews, and our goal was to do 10 to 15. And after doing those interviews, really analyzing them, looking for themes, from those themes being able to generate recommendations for library systems around how to really embed EDI into workforce development. And so we are going to share some of the preliminary findings that we've gathered from those interviews. And I will hand it over to Laura.
Thank you, Ozzy. Yeah, so again, my name is Laura Tadana. I use she, her, hers pronouns. And this is kind of the part where I came in. So I went through the videos, the interviews, and looked for themes or patterns that we could use to help develop this framework. And the session that was before this session, the equity, evaluation, and accountability, I feel like really touched on everything that I'm within the next two slides. So if you want resources and links, I suggest, if you didn't watch it, to watch that one. And then also at the end of our sessions, we'll be sharing some of the links and resources we've collected, and there will be a lot of information in there as well. So as Ozzy explained, she interviewed a range of libraries at different levels. And from the findings, I was able to identify a couple patterns that could be described as equity, diversity, and inclusion, like best practices. And I broke my findings down into two sections. And the first focused on the internal work. And that was moving beyond some of those performative actions to actionable and measurable items that organizations can do to move their institutions forward and creating inclusive and equitable environments. So through the findings, most of the organizations that scored pretty high or felt that they were doing, and then just based on hearing their stories and how their staffs were feeling and responding, you could get a gauge of where they were on a scale. And so from this, it's not a surprise that it has to start with internal work, right? That organizational change had to start from that buy-in from leadership. And so from the interviews, I was able to pull some of the findings and hear some examples of some of those, that it has to be, top down. Staff need to feel as if leadership are supporting them, and there isn't a fear of retaliation if they start, sharing some of their experiences, or they start embarking on some of this EDI work, and EDI, equity, diversity, and inclusion. Additionally, increasing representation in leadership was often noted. I think we talk about increasing representation. Previous slide. We talk about increasing representation in our staff, but it is imperative that there's also voices at the table that bring in diverse thought. And then the need that a lot of these organizations started with that internal audit and that internal assessment to really get an understanding of where they were, so that they could then develop intentionally inclusive practices and policies. And so from here, the other big theme with the internal work was around equity, diversity, and inclusion with their initiatives and strategies. So did these organizations have designated staff or coordinators or stakeholders or committees that were primarily responsible for these EDI initiatives? And then from there, developing frameworks to guide some of the decision making was other things that organizations were doing that helped them with deciding what was going to go into collection development, where it falls within the budget. So having frameworks to help influence what you are deciding on an equitable base was something that was heard throughout almost every interview. Again, prioritizing diversity initiatives into the budget. We heard this a lot when we were talking about collection development and when people begin to weed, what items you're weeding. If you have money within your budget specifically stating this is going for EDI initiatives was something that everyone expressed urgency for. And then as well as mandatory training for leadership and staff, just the same way you would do training with like sexual harassment, as well as like COVID. You know, the individuals getting the training may not be responsible for it, but it is the organization's responsibility to ensure that everybody is getting training so that they're culturally competent and creating inclusive spaces. Next slide, please. And so the second part of this was then to look at intentionally creating equity and inclusion like within everything, specifically starting by prioritizing staff of color. And so in the interviews, we've heard different situations where that wasn't the case. And so making sure that organizations are valuing the mental wellness of staff of color, which could include ensuring that there's safe spaces for them, resources for people to go to, and also thinking about, are there policies and practices embedded within your organization to address harmful environments? So in librarianship, for example, we put customer service as a priority. And so making sure, does your organization have something in place to address when a staff member, specifically from an underrepresented or marginalized group, is attacked or receives an aggression or is put in some type of harmful situation? Is there something in place to help support that staff and really recognize their experience as something that is a priority? And then another thing that should be noted is that paying for labor. You know, if there are individuals doing that EDI work on a volunteer time, like what does that look like? How can you reward their work? As well as if you have staff that are bilingual and that are translating and are constantly being asked to translate, they should be paid for their service. And so recognizing those things we often task our staff of color. And then finally, increasing representation within the recruitment, retention, and advancement process. And so themes that came out of that were rethinking our recruitment practices and job postings, which through the symposium we've heard a lot about. You know, if you're putting out that job and it's designed to narrow into a position, we might need to rethink, like, that's not the best practice and it needs to be a wider net. We should be trying to cast the widest net as possible so that we are bringing in the most individuals that we can possibly get. Creating incentives for professional development and continuing education, as well as advancement opportunities in leadership training. And then the final thing that I'll touch on is, does your organization have something with mentorship? Do you have a specific formalized plan on how individuals that are entering into your organization are going to be mentored? And is there leadership development and a policy in place so that we're ensuring that equity is going towards all leadership development? And so with that, I'll throw it back to Ozzy.
Hello again. Am I muted? No. Okay, awesome. So I won't go into too much of these just to be respectful of time. I did want to go over something that I forgot to touch on in one of the last slides around the longitudinal piece of this. So I came across an article that I think 2017 ALA Emerging Leaders had created. Christina Fuller was on that. Brian, Antonio, I'm blanking on some people, but they had done a project essentially looking very similar to this. They had created some questions, they sent it out to library groups and asked folks to complete the questions, and based on those responses, they interviewed 10 libraries around what they were doing as it relates to EDI broadly speaking, so both externally and internally, whereas this was really specifically looking at workforce development. Theirs was looking at kind of the whole range of it. And so we reached out to them and invited them to be a part of our steering committee. Many of them joined our steering committee. That's how we were able to connect with Laura, actually, through Bethany's connection. And so from that, we wanted to make a longitudinal in order to build on what they were doing and to create a rubric then that libraries can use to measure their progress in the future, with the goal being that this isn't something that is just like a one-off project, right? We'd like to follow up with these interviews, these conversations in a year or 2 or 2 years. We'd like libraries to continue taking the survey to really figure out what they're doing and where they are. And so with the gaps, I'm not going to go into too many of them because a lot of that came up in the last conversation. As Christina alluded to at the beginning, we will be creating a report and some kind of webinar type thing that will be free and available to all. And so you'll definitely get a much deeper analysis after I've spent some more time with the research. But one of the things that I did want to touch on, that you can read some of the things that have come up so far, but one of the things that I think is really, really, really important, especially right now with the time that we are in, is that this is really emotional work and that feelings are involved in it, that a lot of things beyond our intellectual minds are involved in that. And if we don't account for that, if we don't create space to have, not only like to have these difficult conversations, but to feel these difficult emotions, that we're not going to get anywhere with any of this. And so really thinking about what it means to be able to show up for conversations around equity, what it means to create space for people to emote when it comes to talking about the harm that we experience, when it comes to all of those things. And also really an emphasis on repairing harm. Harm not just being like saying, okay, now I'm doing this thing for all of you from this marginalized group to really make your experience better. Are you actually taking ownership of how you haven't done anything up until this point? Are you acknowledging the history that came from that? Because in order for harm to be repaired, in order for trust to come from a place of harm, there has to be a meaningful acknowledgement of what has occurred and why that occurred, and an accounting of what your role was in that, so that they can then begin to trust whatever is to come from whatever lesson you've learned from that. The other things I won't get into because I want to hand it over to Dr. Namrita. But I will say this is one of the questions that came up from one of the interviews that I think I would love for all of you all to reflect on. We talk a lot about recruiting diverse folks and recruiting historically underrepresented folks, but like, how do we need to be changing as an organization so we deserve to have a person, whatever person that is, and to make sure that we don't abuse that person if they join us. And so I will leave that with you all as we transition into the next slide deck.
Is that the original one? The
Yes.
first one?
Mm-hmm. And again, to give more context, part of the grant was to hire a consultant who would interview historically underrepresented staff within our organization, current and former, and that is what we have here, some of the preliminary findings from those interviews.
Awesome. Thank you, Ozzy and Christina and Laura. So again, my name is Dr. Namrita Singh. I use she, her, hers pronouns. So I'm going to be sharing with you a snapshot of some of the findings and initial takeaways, as Ozzy said, that are emerging from the interviews that Christina mentioned were a part of the Building a Pipeline of Community Connection project. So there was a lot of rich and wonderful information that came out of these interviews. And a more in-depth presentation of findings and analysis is going to be presented to the Denver Public Library later on. And some of this will also be publicly available in that report that we talked about earlier. Next slide, please. So this was a qualitative study. Its goal was essentially to understand the range of experiences that current and former staff of color have had while working at DPL. There was a particular emphasis around experiences of racial equity, diversity, and inclusion. Next slide. So we began recruiting individuals and carried out interviews between January and June of this year. Now, initially, these interviews were all intended to be in person, and we did conduct just about half in person. Once we moved into the COVID response, the remaining half of the interviews were conducted over a video conferencing platform. Each interview was about an hour in length, and they were conducted with current and former staff across different kinds of positions in the library system. We specifically only recruited staff of color and or staff from immigrant and refugee backgrounds. In total, we interviewed 30 individuals. Okay, next slide, please. So as we began this process, it was important for us to integrate an equity lens into the recruitment and informed consent process. These are aspects of research and evaluation that are not often addressed when we think about equitable evaluation. So this included actions such as having more engaged personal conversations with potential participants to build rapport and trust, as well as providing participants with a list of local community and healing resources that they could access for themselves if they wished. We also made sure to clarify and name the core values that we were committed to upholding during the research process. And these were values such as humanity, dignity, intellectual and cultural humility, and honesty and transparency. Next slide, please. So in the end, our sample was made up of 17 females and 13 males, a range of racial and ethnic groups. As you can see on the screen, there was more diversity within the Asian and immigrant refugee categories, and of course within all categories, but for anonymity reasons, I won't be breaking that down any further. We had 19 current and 11 former staff representing a range of positions, including shelvers, library program associates, librarians, managers, staff and community programming, HR, accounting, security, and other administrative positions. Next slide. Okay, so now I'm going to present very quickly to you a couple slides that name some of the essential or critical experiences that emerged across participants' narratives. So this means that not everyone named all of these factors, but that these are experiences that came up frequently across the interviews. And so they are representative of the conversations as a whole. Specifically, these slides name what you could think of as barriers to equity and diversity and a feeling of inclusion and belonging. So I'll just go ahead and read through each now. So lack of adequate transparency within the hiring process, experiences of microaggressions or an unsupportive work culture that rewards those who are seen as fitting in, valuing what is seen as comfortable and safe, which reflects a dynamic that keeps staff of color out of the box thinking from staff of color not being rewarded unless packaged carefully or seen as non-threatening, experiences of blacklisting and retribution for speaking out, no good place to go to get support, including HR, which does not feel welcoming or inclusive, and the weighty impact of emotional labor around fitting in and pleasing gatekeepers. And next slide, please. And I just saw in the chat box, yes, I am intentionally off screen right now, just so you can hear my words and really focus in on the data, but I will pop back in during the Q&A. Okay, so more critical experiences, an overemphasis on credentials, including the MLIS, which is inaccessible to many versus lived experience, limited opportunities for advancement without open positions and credentials, the impact of supportive supervisors and professional mentoring on career advancement and diverse representation in management and leadership, the importance of feeling seen, respected, and valued, and the importance of investing in collections reflective of communities and quality translation. Library staff and programming should represent the community, as the library plays a critical role in the community, and diverse staff attract more diversity. And participants also, some of them did note that culture change and transitions are taking place, but it's too early to identify the impact and how far ranging and reaching that will be. And next slide, please. Okay, so now what we have here is a model that I would say is still evolving as the analysis deepens. But this is a model that synthesizes some of the overarching themes that emerge from the interviews. This model responds to those barriers I just named in the previous 2 slides by presenting necessary actions for transforming towards equity. And it also reflects what participants discussed were facilitators, that is the opposite of barriers, or those factors that were helpful and supportive. So let's take a look at the model more closely. The outermost circle points to what needs to exist in the cultural and institutional environments for transformation towards equity to occur. And that is an authentic commitment to EDI systems change. Without that commitment in place, change cannot occur. So that commitment surrounds and supports all aspects of change and must always be in place. At the center, we see trust. Trust is both the starting point and the goal of transformation. And that's why it's at the center, because it is truly the heart of transformation. And we could, really call trust a lot of different things. I'd even say that if we go deeper, this is really love, a kind of radical love. But trust was the language that was reflected in the interviews. So trust reflects what is intimate, our vulnerabilities, our feelings, our humanity, as well as our social bonds and relationships. And that's why it's at the center and radiates outwards. Trust, or perhaps faith, needs to be in place at the onset of some of these actions. For example, leadership choosing to trust the lived experiences of staff of color and valuing that in ways that are comparable to credentials and degrees. And a bidirectional or multi-directional trust is the goal. One where, for example, staff of color also now trust leadership because they've seen that authentic commitment result in positive changes in policy. Okay, so now I'm going to go around and I'll just quickly name the dimensions of change. And again, these emerge from participants' narratives. So going clockwise from the top, we have a willingness to be uncomfortable and to move away from what's safe and the status quo. And that's a very important place to begin. Next, the importance of transparency. So for example, in hiring decisions, as well as being transparent about the anticipated roadmap for change in your organization, so that staff can see the intentionality of actions being taken and how one might lead to another. Again, transparency and showing that authentic commitment and intentionality is important for building that trust. Next, being willing to orient to new perspectives and to embrace creativity. So this was particularly important for staff of color who feel that thinking outside the box is not only not rewarded, but not safe and risks some kind of retribution. And this builds on that willingness to be uncomfortable. Elevate the voices of those historically underrepresented in the field and the community. Create strategic pipelines for staff that again reflect an intentionality around diversifying management, upper management, and leadership roles. And part of that pipeline means valuing lived and professional experience as much as our credentials and degrees, since the latter are often inaccessible, and decolonizing our systems means recognizing the inherent value and wisdom in our communities, in our bodies, and in our lives. And finally, nurture the growth and advancement of staff through professional mentoring and build a more welcoming and inclusive system of supports where staff feel safe to speak up about their experiences and can find meaningful resources for healing. So of course, there are many more pieces that could be brought in, but again, this reflects some of those essential overarching themes discussed in the interviews. Next slide, please. So I'll just go ahead and read one illustrative quote from a participant. For true diversity and inclusion, I believe those in leadership would have to be willing to relinquish those positions. There needs to be some kind of succession planning that is very targeted to their high performing and high potential diverse employees. Start bringing them in, mentoring them, and coaching them, and build concrete career paths into their own leadership positions. Until I see that, equity is an illusion, and to me, other efforts are just not enough. Next slide. So here are some takeaways for you to consider. So values should guide all stages of systems transformation. We need an authentic commitment to EDI systems change to be in place first. We need to be transparent about an anticipated roadmap for creating change. And it's essential to build a trusting, safe, and inclusive environment that fosters belonging, creativity, innovation, and nurtures pathways towards growth. Next slide. So I'll just leave you with this reflection question to think about on your own. So talked about an authentic commitment to EDI systems change needing to be in place first. So what would that take for your organization to have that commitment in place? What does that mean for you? What do you think that would look like? So there's not a one size fits all answer here, but this is really something to grapple with and to think about, and to go back to what was in the model: trust, faith, and even radical love being at the heart of that commitment, as well as values driving that commitment. So all of those pieces, all of those changes need to be the first changes that take place before some of those other actions and policy changes. So this is all coming out of participant narrative, and really the model is just synthesizing that for you. Okay, so I will look forward to the discussion now, and thank you very much for being here. Put my video back on so you can see me.
See, and the rest of us will come back on screen. And as we're doing that, thank you for touching on that, for really centering that trust, because that's one of the things, even with this process, that we've tried to keep at the center. So like I said, I started at DPL in December, and one of my first projects was going to all of our branch locations to talk to the folks within them to say, hey, this is who I am, this is my background, this is what we're doing with this grant, this is what we hope to do, this is how you can hold us accountable to that, because we are committing to demonstrating these things over the course of this period of time, right? And these are what your reasonable expectations for us are at the end of this. I didn't get to go to all of our branch locations. We have 26 of them, but I did go to 23 of them in a 3-month period of time. And I had some really amazing conversations that I think really helped to, one, get us the interviews that we wanted, right? I had taken the time to build trust within our staff, to build trust around this project that then we can use to continue these efforts and to try to repair some of that harm, because it really does take being accountable to what we've done, which is, hey, we haven't done the best so far, and we recognize that, and we want to do better by you, and this is what we're going to try to do better by you, and this is what it's going to look like, and this is what you can expect. And so it's having those conversations with folks across the organization, across identity, to make sure that that is really at the core of your EDI commitment. And so now we'll open it up to questions for you all, or from you all. Let me pull up the documents, actually, if that's where folks are putting them. Okay. How have you been able to prioritize staff of color's participation / wellness without running into HR policies, RE, discrimination, or blowback from white staff who may feel left out? Yeah, I know. I'm in our EDI committee, and we are having trouble reaching out to staff of color and trying to brainstorm. I will take that one. Prior to me starting, the EDI committee and our, they changed their name, our cultural inclusivity and something else committee had collaborated to work to create racial healing circles. And so they piloted the first one in December. And I don't know the work that went into doing that. Christine could probably speak more to that. But we have, since then, I've been leading staff of color circles where we just meet and we have groups, and I don't know that we've had any HR issues with that. It was just something that there is an idea what it would look like to do this thing, and we'll see how it goes. And so far, folks have really enjoyed and appreciated that space. And as far as pushback and blowback, we haven't heard anything. We also have been broadening our wellness efforts within DPL, which is part of what we're doing with the grant, to make sure that it's not just the EAP that we have for folks, but different groups are on different specific things based on people's needs, and making sure that we are really responsive to that. So we did complete a survey for folks, and we were really looking at what are some of the things that you are all looking for that are lacking within our wellness needs, not just for this specific group, but across people who are experiencing a whole host of things. And in combination with two of those things, I think really helped to prevent any potential backlash that we might have received, because it showed that we were intentionally looking at the wellness for all of our staff, but also explicitly focusing on our BIPOC staff. So is there anything you wanted to add to that? I don't know.
I think you summarized it really well. Yeah.
Okay.
Yeah, Ozane, if I could add, I would say that within those committees, be very mindful. I've been part of committees where they're actually more harmful than they are productive. And the things that helped me get through it was having a network of people that I could go to after the meetings to de-stress and talk through some of the things that were said. So if you are in a position where you're able to, speak and stop and disrupt harmful behaviors, and then it goes back to like having those practices of how are we going to address when behaviors and actions are harmful to our staff of color, and like really, really believing that and buying into that, and like supporting our staff, because our staff of color, specifically our Black librarian staff, it's a very difficult time to be working in libraries, especially in how white it is. So having those safe spaces, having those networks, I think is super helpful. Like we here is a great place where, like, after I deal with the hardness of whatever the day was, I go back there and debrief and workshop through situations where you could say things or do things so that it helps you advocate for yourself as well and advocate for others.
Next question. You said that those in leadership need to trust and acknowledge the lived experience of POC. How do you get that trust? Is it something you earn from your employer? I can't ask my employer to trust my experience, especially if I was just hired.
Yeah, I think that was coming from some of the interview data. And, there isn't a one size fits all answer. I will say that in my personal perspective, one of the most important parts of building trust is deep listening, right? And so I think that's a really important starting point. Rather than just say, let's have lived experiences be trusted at face value, really exposing yourself to them through deep listening in order to really see the value in those experiences. Curious what other panelists might think.
Yeah, I agree. And that was part of the conversations that I had with not only the branch managers, but the staff on different levels, where it was me being willing to show up as my full self and to model what that meant, to invite other people to do the same thing, and to be really transparent about what my experience have been that led me to where I'm sitting across from them, and opening up space for them to share what they have experienced that led them to their vantage point as well. And so I think at the core of that, right, is just really being able to ask someone what it is they want, to make sure that what it is they want is reflected in what it is we're trying to do. I kept telling people that I was building this cult of equity, and that's what it felt like, because I was asking people, what is your vision of equity? Just without the intellectualization of it all. Like, how do you feel when you are in an inclusive environment? Tell me a story about that. And from there, figuring out, okay, how can our definition of what we're trying to do and create really include that? And so when people feel seen within that, I think that trust is built in, because they're being asked what they want to know, and they're being asked about what they care about. And so asking the questions and then actually like taking in the answers, but then being able to, I don't know, reflect back and do the same thing with them.
I'll just say that I think it's, it's such a credit to Ozzy as the incredible project manager for this project that she was able to come in, in December and really build that trust and create these connections so we could work with Dr. Namrita Singh and get these interviews and get this information. And I mean, there are a lot of ways a project like this can fail when you don't have that kind of trust and buy-in. And I mean, honestly, things like grants, et cetera, like, these are coming from, the white dominant nonprofit culture. So, of course, we're working within that framework here, but just really want to recognize Ozzy for, being able to really build trust and connect with staff and also, former staff, and getting interviews from former staff has been really incredible.
And I'll just say quickly that, and absolutely, Christina, Ozzy did an amazing job of building that trust. And trust building is not, like I said, it's not a one size fits all approach, and it means a lot of different things to different people. And I think we have to be careful, just as with equity, that we're not trying to check the box by saying, yep, we built trust because we did X, Y, and Z. It's a slow process. It takes time. It takes proving that actions are being put into place and policies are being created that change the institutional environment. And I think it also takes, again, listening and research to understand, what does it mean? What does trust look like for you? So that's why it's not an easy answer, and that's why it's so often, I think, ignored in a lot of our endeavors.
I've seen that a couple times. Dr. Nimrita was the one that did our interviews for us, and so it was an outside person, and staff were aware of that up front. And that we used kind of snowball sampling, right? I went around to the different branches, I shared what the project was, and asked folks if they knew anyone or could recommend anyone who would be willing to participate in that. And based on those recommendations, after folks were communicating to other folks what the project was, we had folks reach out to us. And that is how we were able to really do a lot of our recruitment. Former folks reached out to us because they had talked to someone within their organization that had told them about the project, and they felt that it was something that they were interested in participating in. And so it was really, really just building not only on the trust that we had tried to build within folks, but the trust within other groups of folks within the organization that could then vet for us and really said that they believed in the work that we were trying to do with this project. But yeah, outside consultant was really important so that folks could really actually open up about what they were saying and have that confidentiality, because we internally will never read those interviews and all of those things that'll be over there, but we'll get the reports and all of those things. So we're really making sure that we're protecting the identity of folks.
And I would add also, like, if you are in a leadership position and are trying to figure out ways to build trust, when you do your annual evaluation, that's an excellent time for yourself to get an evaluation from your staff to see if that's something that you're hitting. Do you feel like you can trust me as a supervisor? And if you're getting responses saying no, that might be a time to reflect and see what can you do differently. And if you're reviewing the leadership evaluations, that might be something to factor in as your organization continues to move forward. As a throwaway, we're all learning, we're all growing together.
I'll just jump on that, Laura. I mean, I think over the last 3 years, I at least have seen a lot of willingness to learn from our leadership and executive team. And, Michelle Jeske, our city librarian, was a panelist earlier in this symposium and, has written and spoken a lot to our staff about kind of her learning process on this. So that's something that I've really appreciated in our organization. I mean, of course, we have a long way to go, but, I appreciate that a lot.
Yeah, and it was noted too, like there is that also the power inequity. And so if you don't have the ability to directly tell your boss, like, hey, I don't trust you, like the organization should have a way to be able to pull that information without harming the staff that are providing that data.
Laura, I think this question is for you. Well, I mean, anyone can answer, but I am not going to answer it. How transferable do you feel some of these aspects are to academic libraries that rely on, parentheses, unfortunately, degrees, etc.? Lived experience is harder to sell to recruitments, at least in my experience, certainly with higher administrators who are white senior women.
Can you drop the question in the chat box? I missed the first part of it. Yeah, I think this goes kind of, we're starting to see more and more organizations drop those year experience requirements, right? Like you need to have 2 years or 5 years of working in a library setting to get this entry level job. And really looking at, what within your job postings can you edit, even if it's just a line that says, if you feel like you would like to explain or like, provide more detailed to this, we're open to bringing in the most diverse candidates as possible, even just a sentence. But other things to think about that I've seen in different organizations is like, what system are you also even using for the recruitment process, right? Like, is it Workday? Is it some other weird clunky system that's having applicants do so much, and there's just barrier after barrier after barrier that by the time you're done with the application. And so things that organizations could do is like having a group of people to review job postings before they're posted publicly, so that a diverse thought group can identify the issues within the job postings that would narrow out candidates. The same way, like when they're coming in for interviewing, having a different group of people also provide that interview process, right? Like having a separate panel, so that, or having somebody whose job is around equity, inclusion, diversity, appointed to the interview committee, so that you can ensure that the interviews are going equitable and fairly. And I think a lot of times that's a step that's again ignored in a lot of different places.
Yeah, to build on Laura's point, I totally agree. I think valuing lived experience can mean a lot of different things, right? It can sound like a vague phrase, but we can think about reaching out to communities that are directly served or could be directly served by programming and or are underrepresented. So valuing lived experience means first seeing that there's value there, to then reach out to those communities for recruitment efforts. I've seen as well in another organizational setting where they're actually working with medical providers, still taking into account the degrees. Obviously that's necessary for a medical field, but also making sure to score lived experience in a different way. So providing that space, like Laura talked about, where you can offer some information about your background beyond your professional trajectory, and making sure intentionally to score that in a very specific way. And then also valuing lived experience means, again, being willing to listen to the insights, the creativity, the new ideas that come out of that experience. So I think there's a lot of ways to operationalize that, that we can think about at different stages, so that we move away from it just being kind of a vague statement.
We'll do 5 more minutes. One, I think someone says, where is the authentic commitment to EDI systems change from? I'd like to use in our work and want to give credit.
That's a part of the analysis that's coming out of the qualitative findings that I'm putting together. So it's authenticity and authentic commitment. Those were, that was language that came out of the interviews that I conducted with the current and former staff. That phrase itself is a phrase I developed for this model.
Judy had a comment in the chat that I wanted to address around being hesitant to come into the librarian field. I think that's fair, and I think that's valid, and I think that's a conversation that we need to have as we recruit more folks into this profession, into whatever profession. I I'm going to be honest, I felt really disheartened when I realized that all of my mentors had struggled in all of these really harsh ways and had kind of like been silent about the struggle and not really authentic about what it meant to commit to this thing that I felt really passionate about, because I think you deserve to know what you're walking into. And I think it would be remiss for me to mentor anyone and not prepare them for how difficult and how ugly it can be, but also how beautiful it can be to do this work, right? And so I'm glad that you are being exposed to other aspects of it, but I hope you can also see the parts that make it worth pursuing and see the balance of both of them and find supports to do that, because I think that's definitely possible. There is a question around interviewing. How do you conduct interviews and build trust in a virtual network or in a virtual world post-COVID or in COVID? Oh, here it is. What, with COVID and social distancing practices, how do we do the authentic work of interviewing? Any thoughts and suggestions?
Ozzy, do you want to comment first, and then I'll piggyback on you since I've been talking?
Yeah, I feel as though the virtual conversations that I've had with folks have deepened our relationships in ways that didn't exist in the day-to-day. I have been now working from home longer than I was at my desk, which is really interesting. But even in that virtual space, it's just checking in on folks, asking them about things other than the work that they're doing, asking them about their lives, like what brought them joy that day, that week, what's one thing that they're looking forward to, all of those really simple things that just really center around seeing a person as a human being, not something that you're extracting things from, not information, not work, not anything else, but really trying to really pay attention to that. And so I've just been being really responsive and accessible to people, checking in on them, checking in on their well-being, all of those things, and making sure that when having conversations, when like reaching out to folks to recruit them, that is where I start with not, hey, would you do this thing for me? But like, hey, I understand that this thing in the world is happening. I hope that you're doing okay and taking care. And also, here is something that I'd be interested if you are willing and have the capacity to do this thing. So being a human, being humaning, I think.
Yeah, totally. And I think some of that is just, those are practices, whether you're in person or virtual. You know, clearly virtual, it's a little bit harder to build that sense of rapport. But one good thing is, I think, you know, we're all getting more used to these platforms, and being able to see each other is really helpful for that rapport building. I think as well, again, going back to what I was speaking about of just identifying our values, and really there is that uneven researched dynamic that exists in research and evaluation. And so by centering first our commitments and how we hold ourselves accountable, also, you know, being transparent about what this work can and may not achieve. I think oftentimes there's a lot of raised expectations. So we made very clear to say that here's what we do know, that your experiences will be heard and listened to. Here's what we cannot say, that everything that's recommended will be implemented. And I think steps like that really help to build some sense of trust and openness. And totally agree with Ozzy, you know, just being a human, asking people about how they are, understanding the dynamics of, you know, people might have kids to take care of during an interview, making sure they have something to drink and take a break if they need to. All these things are just taking care of the person as they're sharing what they need to share.
Okay, I think we have kept you all too long. Thank you again for sticking through this with us. Yes, recordings will be available immediately on our YouTube and on the symposium site. We'll say like a week or so after the symposium. And do not quote me on that. We will try our best to ensure that, but we are all humans humaning, so we'll see when that happens. But they are immediately on our YouTube. Thank you for your questions. Thank you for your comments. Thank you for the vulnerability and all the resources that were shared in the chat and all the feedback, because that's very helpful as we continue on this project, because we are not at the end of it, right? We are kind of in the middle of it, right? And we look forward to seeing some of you at the World Cafe in a little bit. We look forward to seeing some of you at the closing and during our performance from Black Excellence. Until then, take care, and I hope you get some food in you.
Thanks, everyone.
And thank you to our panelists. I'm sorry, y'all.
Thanks, all of you.
Thank
Bye.
you.
And thank
Bye.
you. Oh, shoot. And thank you to Rodney. I'm so sorry. I'm spacing
Hey,
out.
Rodney. We
Yes.
love Rodney.
Yes. Shout out to you. And Zaki always.
Mhm.
Okay, I'm ending it.